The goal of swallowing is to move food and liquid from your mouth to your stomach. After an eating and/or swallowing problem has been found, you may be asked to participate in therapy or treatment. The goal is to help manage any problems that you have with chewing or swallowing. Therapy across the medical setting might include drugs in the medical domain, removing structures in your body in the surgical domain, or behavioral therapy. We'll focus on behavioral therapy because speech-language pathologists do this type of therapy. Behavioral therapy might involve altering food or ways that you eat them, adjusting head and/or neck postures, learning to swallow differently, which is swallowing maneuvers. Other strategies might include learning to take smaller bites, remembering to cough after you swallow, or to swallow more than once after each bite. It may also include training with devices and hopefully, importantly, practicing eating. Altering foods or ways to eat might include changing the food itself, sometimes to a thicker or smaller amount. It may also involve changing the way that you take your food in, such as adding straws or maybe eliminating straws. Changing head or neck postures might include putting your chin down or up. It might involve turning your head to the right or to the left, or tilting your head to the right or to the left. Swallowing maneuvers means changing the swallow itself. These are often hidden from us and can typically only be seen with some type of imaging, shown here as an example with a swallowing X-ray. This is an example of what we call the Mendelssohn maneuver, which involves swallowing and holding up your voice box for at least 2 seconds. Training devices might include approaches such as electrical stimulation or lingual strengthening. And hopefully practicing eating is the most obvious, which is eating the foods that you have trouble with, hopefully to help you learn how to eat them again. Therapy can be recommended if you have eating or swallowing problems. Therapy might include learning to eat differently or to use devices. And therapy is best when you are motivated and understand your therapy goals.